Hello, my name is Haley Bryson. I am here to talk about the patient that I had on my remediation. Her name is Lena Mengistu. She was a 37-year-old female. She presented to the clinic with bright red vaginal bleeding. She was not having contractions at the time. Her baby's gestational age is 32 weeks plus 1 day. So placenta previa is what the diagnosis was. Placenta previa is when the placenta is covering the cervix. It can either be partial or complete, and that all determines what the treatment is. In this case, our patient was able to be discharged home. She was on strict bed rest. She had to have a sitter with her at all times. She was to never be alone. She had several different courses of actions that she would have to take to be at home safely, but they did end up discharging her. So there were two areas that I really feel like this patient would need education on. One would be implementing that bed rest, avoiding all strenuous activity, and not only just telling her to avoid things such as running, jumping, lifting, but it really is important to understand the why. And so we want to avoid this because any running, jumping, lifting, strenuous activity is going to put extra pressure on that uterus, and that can cause the uterus to shift, and that is very dangerous for placenta previa patients. It can cause them to hemorrhage. So implementing that why is important. Number two, I feel like she needed to be taught about no sexual intercourse. We will have no digital manipulation, no tampons, no douches, anything that's applying pressure on the uterus is is very dangerous. So we have to implement that why. So anything putting pressure on that uterus and that spot where it's where the placenta is over the cervix, any kind of touch or movement can promote hemorrhage and would be very dangerous for not only the baby but the mom itself. Um, so treatment depends on several things. It would depend on severity of bleeding, gestational age of the baby, position of placenta and the baby, and the overall health of the mom and the fetus. Some risk factors that contribute to this disease would be advanced maternal age, multiple pregnancies, smoking, cocaine use, history of cesarean sections. Um, and a big thing to tell our patients as well going through this that most of them are going to end up in C-sections. Um, so it would be a good thing to go ahead and talk that over with the parents to understand what could happen. And most of them, because of where the baby or fetus and the placenta is, will have to be a vertical incision. So that's nice to know as well, just to kind of go in forward point. Well, that will be all for me and my patient today. Thank you guys so much.